final organisation, ladies and gentlemen, Malpa, trains Indigenous and non-Indigenous youth to become health ambassadors. Here to tell us more, CEO Don Palmer. Don.
Thank you, Patrick, and thank you to TFN who have been good friends on our journey. Junkajara, that's what the elders said to me. If we're going to solve anything, it's got to be together. It's got to be Junkajara. My journey started in Central Australia. I was a documentary filmmaker, and I was in one of the squalid town camps, which are like a fourth world experience, if any of you have ever been in that situation. And I was sitting around the fire with a group of people, and a young mother thrust into my arms her 18-month-old child, and the child was covered in, the clothes were soaked in urine, and her face had gunk coming out of the nose and out of the ears. And she said to me, "I don't know what to do. Can you help me?" And this cut through something. I couldn't get on an aeroplane in Alice Springs and drink a glass of Chardonnay, fly back to the North Shore of Sydney and think to myself, isn't it terrible? Somebody should do something. I felt impelled to look at this. I felt I was sitting in the presence of two significant things. One was this crushing of the spirit that you see for so many Indigenous people. The light gone out of their eyes, the hope about the future absolutely squashed. And the other one was the health problem. This is not the young girl in concern, this is Veronica. She's got the same problem. You can see the runny nose. As many as 91% of Aboriginal kids under 11 have got this runny nose. And what it is basically bacteria in mucus, and it leads very rapidly to deafness. So much so, young men in prisons in New South Wales, 83% of Aboriginal young men in New South Wales jails are functionally deaf. And it goes back to this simple hygiene problem. So the kids get otitis media, they can't hear. There's no point going to school. They won't get a job, they'll likely end up in prison, they'll have chronic ill health, and they'll lead a very short life. And it's all so unnecessary. So I said to my friends, the elders, why does nothing work? We spend all this money as a society and nothing works. Australia wants this to be different, but it doesn't seem to ever get better. And I said, two important things. They said, one is you need to do it our way. The other one is that you need to involve us in the solution. So help me understand your way. They said our way, and it's worked for 40,000 years, so that's pretty good proof of model. They said our way is that the Nunkuru, that is our traditional healers, look around for young children as young as 4 years of age, and they start transferring the health knowledge to the kids with the expectation that those chosen children will act as young doctors in the community. And that's what they do. They grow up looking out for their peers and their siblings and carrying the health stories and the health messages. Okay, well, let's try something and see what it works. This is what we did. We said those communities who invite us in, we will sit down with them and we'll say, what do you think your children need to lead a good and a healthy life and a happy life? Every community knows, and the answers are different in every community. And with them, we helped construct a model for about a 15-week program whereby the children are taught the old ways, if I may. We've got the new ways and the old ways of health, where they will learn some traditional medicine as much as it's available in the local community. And here's one of our traditional medicine people in Barrack Heights teaching the children so that when they walk through the bush, it's not just lovely green leaves and a nice place for a picnic, but it's like a pharmacy to them. This one for sunburn, that one for a stomachache. Most of all, though, they work with modern clinicians. And here's someone from the Aboriginal Doctors Association, and they now attach a doctor to each of our projects. So the kids learn a whole lot of stuff about hygiene, about nutrition, about health leadership, environmental health, and increasingly importantly and sadly, about well-being. How do you cope with your emotions? What happens when things are going really bad at home? How do you deal with that? Because as many as 1 in 5 Aboriginal children do not live with their parents. The social breakdown is enormous. So what we're doing is we create an environment where the local people provide their chosen solution and we support them to construct it and to deliver it. They will bring in people like a doctor, a traditional healer, they'll bring in a dentist, they'll bring in all the people that they need, and these 10-year-old children soak this knowledge up like you wouldn't believe. Anyone with 10-year-old children? You know what it's like. But not only do they soak up the knowledge, they can't stop themselves giving it away. They go home and they talk about it. Yep, all the time. And the parents change their behaviour too. They're shopping in a different part of the supermarket. They're buying fresh fruit and vegetables. They're not smoking at home. They're doing different things. The change has been astonishing to us. The biggest single indicator, and I hope the Minister is listening, the biggest single indicator is that the projects we run in the city, in the remote areas and in the regional areas, we usually get 100% school attendance. In fact, at one school, instead of doing it one day a week, they were doing it every afternoon. Instead of 15 kids coming along for the session, there were 39 children coming every afternoon. And the people we were paying to deliver it, they weren't asking for any more money. So this resonates deeply with them. It works. I'm so proud of what the communities are doing. They're taking their own control over their own health futures, and we can see the transformation happening in front of our eyes. So we hope that you might be Malpas, that is, friends on the journey of life for healing our Indigenous communities and the non-Indigenous kids who join in with them, and that together we can make a real difference. Thank you.
Thanks, Don. Questions, ladies and gentlemen, for Don? Yes, right over here, sir.
G'day, Don. Thank you for such an inspiring presentation. I was just wondering if you could tell us a bit more about your partnership with the Indigenous Doctors Association.
Yes, we were very lucky. We involved them in a program in Adelaide, and they so enjoyed what they did, and they were working on that particular program with 3 Ngangkari women, and they then approached us and said, look, we think this is potentially creating important career health pathways for the children, and we want to walk with you on the journey. So they now attach a doctor or a trainee doctor to every one of our projects, not only to teach stuff to the kids, but also to inspire and be role models for our leaders.
Thank you. Next question, ladies and gentlemen.
I'll put you on your lapel, so I'm just going to use that one.
Yep.
Right. Don, how many communities are you working in at the moment, and what's the growth strategy for the program?
Okay, we've got currently we've got 4 programs running at any one time in Kempsey. We've got 3 at any one time south of Wollongong. We've got 1 in Melbourne. We're starting 10 in East Gippsland. We're very proud to say that we're just starting at the school. Thank you. Namaji School down south of Canberra, and we think that's going to grow, and also South Australia. So we go only where we are invited. We don't knock on doors. We wait for the songlines, the traditional message linking for communities to tell communities. This worked for us, why don't you see if that will work for you? And so we've now got 500 young doctors, and we're training a further 400 this year.
Cool. I've got a quick question, Don. We're $10,000. Where would that go? How would that help?
$10,000 would be a terrific boost. That would help us run one program. And that means it involves 15 children, Indigenous and non-Indigenous. It involves their parents, the elders, the people who come in and deliver the sessions, all their resources and the support that we also give to them.
Cool. Great. Question, Lisa? Yell it out.
Don, if you could remove one barrier that's getting in your way to grow, what would that be?
Did you hear that, ladies and gentlemen? If you could, it's a good, really cunning question. I'll give Don a chance to think about it. If you could remove one barrier in your way to growth, what would that be?
That's a really tough question, but a good one. I think what I would like to remove is the feeling in the wider Australian community that nothing will work. Because I've seen good innovative programs in which ours is but one actually succeed, and I think that instead of people going sigh whenever they hear this is a story about Aboriginal Australians, that we really do believe, evidence-based, that Indigenous people, when we walk together with them respectfully and listen deeply, the transformation really can take place.
Sir.
Have you gone back into the communities afterwards and seen the impact 1, 3, 5 years on?
Yeah, well, we've only been going 3 years, but we
What
do.
about 5 years?
We do measure before a program and after a program because we don't want to measure simple activity. We want to measure actual change, and we've seen that change happening. And we want to commit to communities in the long term. And so projects have been running for 3 years in the Kempsey area, for example, and in Melbourne for 2 years, down Barrack Heights district there, once again for 3 years. So we really like to walk that journey, and you can see not only the kids change, but you can see the parents sort of realise that they can take charge of what their future is going to be.
Mm-hmm. Sorry, yes. Well done. Thanks, Tom.
For a new project, who would be your partners in the community? That community?
We always sit down first with the elders, and we always give all credit to the elders. They're the ones who present the certificates. They come and tell their stories to the kids. It's always the elders at the core of it. And then they develop the relationships with people like the local health providers and clinicians and people with the traditional knowledge. Here's a group of our children. So all as happy as Larry. There's 3 Indigenous kids there and 2 non-Indigenous kids. When we started the project, only 3 of them had their own bed to sleep in, and only 2 of them had their own toothbrush. So happy little kids, but you can see they're starting behind the 8 ball, and every little kid there, behind those cheerful eyes, is a tough story. But they're starting to get on top of it, and they're starting to dream dreamable dreams, if I can put it that way, realistic dreams about who they can be in the future.
Great. Yes, ma'am. Over there, Tom, sorry.
I just yell it out. I'm just wondering, how do you actually get the doctors? Do the school refer a number to them, or do you pick them individually, just and in terms of numbers for each school? How do you...
The community chooses, and they choose 8 Indigenous children, and those children are invited then to bring along a Malpa, a friend on the journey. And that's really important. The elders told us that this can't just be an Indigenous program. That breeds resentment and that bitterness in a community. So the non-Indigenous kids gain an incredible respect for the old ways and the old knowledge. They build friendships which we hope will be lifelong. And above that, the parents, the non-Indigenous parents and the Indigenous parents, have got a safe place where they start forming relationships and having conversations. And so it builds a beautiful sense of community.
That's great. One more question, ladies and gentlemen. Have we got one? Yes, down there, Tommy.
Thank you. Just wondering, have you thought about or considered how you might interact with people undertaking teaching training as well? So that's that other opportunity to have educators have a good understanding and appreciation for both cultural aspects.
Yes, we are. That's a good question. We are thinking about that because we're looking at developing a secondary school product so that we can sort of nourish the information and the thing that's the dynamic that's happened amongst the kids. Always the thing is these are local people. They're not people from out of town. So local people constructing their own answer but being helped to do it. So we don't. Sometimes people will come in from further afield. But it's the local people who live there and who will continue to live there, and that's the pride we're trying to develop there, but we want to be able to access the skills and capabilities of other people with a strong heart and a clear head.
Great stuff. Thank you, Don. Thank you very much.
Thank you.